Hi friends, welcome to today's video is on NABH 6th edition first chapter SS assessment continuity of care, second standard and the second standard's first objective element. Let us see. The organization uses written guidance for registering and admitting patient. So the organization should have the written policy for the registration and admission of the patient. There should be the policy for the registration. There should be the policy for the admission. Registration policies should have for the outpatient registration, inpatient registration policy, daycare, emergency. Everything should be included in the registration policy. The policy for admissions will be for the daycare and IP both. Policy for unidentified person registration should be there. Policy for MTP registration should be there. Wherever the MTP cases are coming, the unique whatever the registration has done for the patient, and one more your ID will be generated for the MTP registration. As per the government rule, that should be followed. So MTP registration policy also should be there. All patients should be registered with the hospital unique hospital identity number, and general consent should be taken for the patient during the admissions, which will not include the invasive procedures. So these are the requirement of this standard. So let us see what and all the requirement. So this is the general informed consent. So general informed consent is yours. This is the consent which will not include your the invasive procedure. This is only the information informed consent that these are the services we are providing, and the patient is agreed for our services. That's it. But if patient is going under any surgery or ICU admission or anything, then the separate consent will be taken for that. Registration policy will cover policy on registration, purpose, scope of services, your registration procedure, your quick registration procedure, MTP registration, newborn registration, manpower planning, job responsibilities, departmental procedures as per NABH standard, and the wherever the policies are available and what is the review period for the policy. So these are the things will be covered in your registration policy. And admission policy should cover introduction to the department, your purpose, your scope, then what is the policy of your what is the admission policy, and unidentified patient how you will admit. Then the registration procedure should be there, then the type of admission or procedure should be there, then policy for the foreign or nationals registration and admission should be there, then who is responsible to do the admission, then who will do the admission counseling, then pre-admission counseling policy, then your admission flowchart should be there, then your manpower planning, then who will do what, the job responsibility should be defined, and when it will be reviewed and where and all it will be available, and whatever the forms you are using in your admission counter as an annexer you should put in the policy, whichever the policy you are making. Whenever it may be the registration policy, it may be the admission policy, you can prepare your departmental policy. So that time whatever forms you are using, you put in the annexer in that policy, so it will be easy to find your staff also, and easy to know and easy to train your staff regarding your department. Thank you. If any further information required or anything needed, please comment so I will reply to that, or else, and your opinion also is more valuable for me for any further improvement. Thank you.